All right, let's get right into it. Today, we're talking about a company I'm sure you've heard of, Philips. But we're going to look at them in a context you probably haven't before. Pharmacy automation. Yeah, I know. We're going to unpack their surprisingly huge role in a field where at first glance, they don't seem to belong.
So do me a favor. When I say the words pharmacy automation, what's the very first image that pops into your head? For most of us, it's something really specific, something very, well, robotic.
I'm willing to bet it's this, right? A super sophisticated robot arm, precisely counting pills and dropping them into a little bottle. That is the classic image of pharmacy automation. And you know what? It's a huge part of the industry. So that picture in your head, it's not wrong.
Which brings us to the big question of this whole explainer. If that's what pharmacy automation is, then why on earth are we talking about Philips? You know, the company that makes those massive MRI machines, and maybe the electric toothbrush sitting on your bathroom counter. What do they have to do with any of this?
And look, if you're thinking, wait a minute, Philips doesn't make those robots, you are absolutely right. They are not a dispensing robot vendor. They're playing a totally different game. They see themselves as a health technology ecosystem partner. And understanding that one little difference is the key to this entire story.
To really see where Philips fits in, we have to zoom out, way out. We have to look beyond that single pill-counting robot and completely reframe what automation even means inside a modern hospital.
And that brings us to this really crucial definition, medication workflow automation. Now, this isn't about one machine doing one task. No. This is about an entire integrated system that connects a patient's whole journey from the moment they get diagnosed through their therapy and into monitoring, all of it powered by data to make the whole process safer and way more efficient.
And this is where it all starts to click. Just look at where Philips makes its money. Almost half, 48% of their revenue, comes from diagnosis and treatment. Their entire business is already built right at the very beginning of that patient journey we were just talking about.
So here's their big pitch. You know how hospitals are just full of different devices that don't talk to each other? The MRI machine is over here, the ICU monitor's over there, it's all in these separate silos. Well, Philips wants to be the bridge. They want to be the thing that connects all the devices, all the data, and all the different departments.
So, what does this actually look like in a real hospital? Let's break down how this whole connected workflow thing actually works. This is where the idea becomes reality. Okay, so let's follow a patient. It all starts with a diagnosis, right? Maybe using a Philips CT scanner. Then comes step 2, therapy, which could involve one of their image-guided systems. And finally, step 3, constant monitoring in the ICU on a Philips monitor. Every single one of those steps is creating a mountain of critical data. And these are the Lego bricks they're using to build their system. You've got the big, impressive imaging machines, the patient monitors right at the bedside, and even stuff for care at home. But the real secret sauce, the glue that holds it all together, is that last one, the health informatics platforms that make sense of all that data.
So what's the point of all this? Why connect everything? Well, it's all about making sure the right information gets to the right person at the right time. When data flows smoothly, you get fewer medication errors, and the entire hospital, from the pharmacy all the way to the patient's bedside, just runs more efficiently.
Okay, but it's not all sunshine and roses. No company is perfect, right? So to get the real story, we have to look at both the incredible strengths that make this vision even possible and some of the really critical challenges Philips is up against.
First, just a little bit of context. Philips has been around forever, since 1891. But for our story, things get interesting in the 2010s. That's when they really hit the gas on shifting away from things like TVs and light bulbs to become the health tech giant they are today, where healthcare is, by far, the biggest part of their business.
And this strategy really leans into what makes them so powerful. First, they have a massive global brand and the sheer scale to back it up. Second, their products cover almost the entire patient journey. And finally, and this is a big one, so many hospitals already use their equipment, giving them a huge foot in the door.
However, and this is a big however, they are facing some serious headwinds. You might have heard about the massive 2021 recall of their Respironics breathing devices. It's caused huge financial and reputational damage, and, as this quote shows, has even led to a criminal investigation in France. This is a massive problem for them.
And that's the wild thing about Philips. Even with these massive challenges, they are still an absolute behemoth. We are talking about a company with, get this, roughly 68,000 employees around the world. That gives them incredible resources to try and solve these problems while still pushing their big ecosystem strategy forward.
Okay, so let's pull all of this together. Why does understanding what Philips is trying to do actually matter for anyone who cares about the future of healthcare?
Here it is. This is the main takeaway. Philips isn't trying to sell you a better pill-counting robot. They are trying to become the essential strategic partner that a hospital relies on to build its entire connected medication ecosystem. The automation they're selling is in the data, the workflow, the integration, not just in the little plastic vial.
And that leaves us with one final, kind of mind-bending thought to chew on. As our hospitals get smarter and more connected, is it possible that the most important, the most critical part of pharmacy automation won't be a robot you can see at all, but a huge, invisible system of data working behind the scenes?